Julia!
You off on your rounds?
Yep.
Might be a bit tricky.
Why?
Patient list. Jimmy, is there something on your mind?
About a dozen patients.
Ruth, nice to see you.
Julia, where shall I set up?
Well, I thought my office would be best.
Let's get cracking.
My son Antoine has an appointment.
Is that 12:10?
Yes.
It's now 12:20.
I can tell the time.
So Dr. Bell is with her next patient. Do take a seat. I'll call you when there's a gap.
The last time I came, we waited for half an hour to be seen, which is why we're not early. I'm not going to sit there waiting all day.
Who's next?
Mrs. Morrow.
You just said I had to wait.
Till there was a gap, which is now. Do go through.
Claude.
You already know Vivian can be quite stubborn, and Michelle can be, well, the same, actually.
Don't worry. Character typing is an extremely valuable tool for resolving workplace conflict. Through the use of the inventory and interactive feedback, I will enhance their perceptions of themselves, each other, and their dysfunctional transactions.
I'll go and get them.
So what can I do for you?
It's in the notes.
Sorry, my writing's terrible.
We brought him in at 12 months because he wasn't talking, and you told us to monitor the situation. We have. He's now 15 months and he still hasn't said a word.
Does he try to speak?
A little.
He makes noises, but nothing you call speech.
Well, different children do progress at
At different rates, I understand. But we're both intelligent people, and Claude works from home, so Antoine gets a lot of stimulation. He should have said something by now.
Maybe he just doesn't get the chance.
Dr. Bell, do you intend to take this problem seriously? Or shall I tell your practice manager that you think a child's developmental shortfalls are something to joke about?
Michelle and I don't get on. We both know it. It's not a problem.
Maybe not for you, but it is for the rest of us. So can we please make a start?
I don't see Michelle going in.
Just called her. She's on her way. Oh, you see? Nice to see somebody taking a mature approach. Vivian, please.
Antoine. Good boy. Well, there don't seem to be any obvious ear problems, so...
He's not
that
deaf.
reduces-
The problem is he can't talk.
Mrs. Moreau, the reason why a lot of children have difficulty speaking is because they're not actually hearing what's being said.
Just tell me what you intend to do about it.
A dog, une vache, a cow.
Oh, you're teaching him French and English at the same time.
As a child, you learn a second language much more quickly.
Maybe that's part of the problem. Antoine's getting confused.
Dr. Bell, I didn't come here for a critique of our parenting skills.
I wasn't...
Can you just tell us what you're going to do?
Well, if he's still not speaking in a couple of months, then I'll refer him to a paediatrician who'll be able to carry out a full assessment.
You're going to do nothing.
It's most probably just late development.
What if it isn't? He had the MMR jab. What if it's autism? He needs to see a specialist now.
Well, that research was pretty much discredited.
Not everyone thinks it was wrong. Antoine is aggressive with other children. Well, you'd expect that with autism, wouldn't you, Doctor?
Possibly. I'd also expect it if he was frustrated. A paediatrician would be best placed. Mrs. Moreau?
I'm not wasting any more of my time. You've made jokes, you've been patronising, and now you're going to do nothing. It's unbelievable. Claude.
After lunch, we'll do the inventory.
Do what?
A test. That's incorrect, Vivian. There are no right or wrong answers. Your responses will reveal your personality types and the potential areas of conflict between you.
I thought it was unique.
You are.
Of course, I'm not devaluing your individuality, but each unique person falls into one of 12 different types, which have been defined by years of study.
Like horoscopes.
Hardly. It's extremely thorough, pays tribute to Jungian archetypes, and has proved to be both accurate and useful. I'm sure you'll feel the benefits later when you use it to assess your own shortcomings.
Our what?
I'm sorry, your personal challenges. But we'll deal with that later. Right now, I'd like to look at role play.
What type should I be then? Cheese or ham and pickle?
I'm sorry?
What type of roll should I be? Should I be a cheese roll, a ham and pickle roll? was supposed to be a joke. It doesn't matter.
I don't do jokes.
No, I'm busy. And this is totally pointless.
And I wouldn't be surprised if you're revealed as highly judgmental and prepared to make assertions based on prejudice and willful misunderstanding. Now, let's look if we can at an everyday situation. Vivian, you're working at the desk. Michelle, you come into reception with a typical question for Vivian.
Like, is she thinking of leaving?
I expect that was another attempt at humour. Vivian, you put the phone down, having arranged another appointment.
That isn't all I do, you know.
Well, this is just an exercise. Don't get defensive. And put down the phone and go. Good. And in comes Michelle. And you have to find a patient's notes. Go. Go.
Yes.
Well, there's a problem.
About the notes.
No, you're facing the wrong way.
What?
It's just if you put your phone down over there, it means the desk's there, which means you're facing that way.
I'm sorry. I didn't know this was a mind class.
It's not, it's just if you put your phone down over there...
I didn't!
Yes, you did, which means I'm talking to the window!
Sorry to interrupt. Are you going to stop for lunch?
Yes!
Well, I hope they're behaving.
Anna! I think I got a new commission.
Good. Maybe we can pay the mortgage next month.
I'm trying to get work.
Trying doesn't pay the bills.
But in France I had clients and now...
My mother's dead, Claude. Do you think I should leave my father with no one?
I'm just saying that it takes time to build a new business. And working from home, there are so many interruptions.
You didn't have to come to the doctors.
I'm worried too.
You didn't seem it. You didn't say a word.
I was listening to her.
We listened to them about the MMR jab. I wanted them separate, but no.
I don't think it is connected.
Well, you would think that, wouldn't you? You were on their side.
It is not about sides. It is about what is best for Antoine. Where are you going?
I'm meeting my father. But don't worry. Antoine's asleep. No one's going to stop you getting on.
Melody?
Sorry. It's just this patient. She's so convinced that she's right that she won't listen to me.
Hannah Moran?
Yeah, you know.
Yeah. She didn't like my attitude, which is why she asked for you now.
Not for much longer.
Oh, what's wrong with her?
No, it's Antoine. He's not talking properly.
He must be back. A year old?
15 months.
That's not necessarily abnormal.
Well, that's exactly what I told her. And they're teaching him French at the same time. I mean, not as a second language, as joint. I'd be confused, wouldn't you?
C'est possible. I don't think it'd stop him talking altogether. And if it were your child, would you not be worried?
I'd want it looked at.
So you just might kick up a fuss.
Yeah, I suppose I would, actually. It could be a learning disability or an auditory processing disorder or even autism.
Well, hopefully the paediatrician will confirm it's none of those. I assume you've referred them.
No, I didn't get the chance. She just kept going on about the autism.
Look, I know she's not easy. But she's not the patient, is she?
Shall we order?
Ruth, I was doing a bit of eavesdropping over lunch, and I think they got more out of this than they're letting on.
Really?
Yeah. I think their only criticism was something about it was a bit slow, and they thought maybe they would have gone into the issues deeper than they did.
Oh, I thought it was all a bit too much for them.
Oh, no, I don't think so, no. No, I think that's all an act. I think you could push them really hard this afternoon.
Right. I'll see how far they're willing to stretch.
Hello?
Hello, Dr. Clare.
I wasn't sure you'd call.
I had to.
I'm sorry about yesterday. Shouldn't have said anything. Eva.
I don't feel very well.
What?
I don't seem to want to do anything except lie in bed. I really think you should come round and see me.
Well, the thing is, I've got a lot of patients to see this afternoon.
You could come after. I really shouldn't be left on my own. Not the way I'm feeling.
You're alone?
Yeah. You won't be back till late.
I'll be there as quickly as I can. You just make yourself comfortable.
Thank you, Doctor. Oh, and please hurry.
Be as quick as I can. Bye. Julia, Jimmy, yeah, can you let my patients know I skipped lunch so I can get to them early? Thanks, bye.
How was your father?
Fine.
The doctor called. She's referring Antoine to a pediatrician today.
Really?
Thought you would be pleased.
About what? Being referred to someone else who will refer us to someone else so we can find out what we already know when it's all too late.
It won't take long.
It doesn't matter. He's not going.
What?
I'm finding an autism specialist and I'm taking him myself.
Privately? But we haven't got the money.
My father has. So we can forget about Dr. Bell and her pediatrician.
Forget them. What if it is not autism? What if...
He had the vaccine. He's not talking, he's aggressive, and he's my child. I know what's wrong.
The doctor said she...
My mother died while doctors passed her around the NHS. So you can wait for the doctor. I'm taking care of my son.
Time's up, thank you. So I'm sure there are some fascinating answers here, but before we look into your personality types, I want to give you a quick exercise in developing rapport. This is often achieved through mirroring behaviour. Changing postures at the same time, having a drink following each other, synchronising breathing, that sort of thing. All these little things can be used consciously to increase rapport. So if you pull your chairs out and face each other, please. Come on. Now, try and mirror each other's postures. Just takes one to start. Good. Now, let's try and start a simple conversation. Let's try and stay in agreement, nothing too controversial. So relax and breathe, mirror, and go ahead. Good.
You know, I wouldn't even have to be here if it weren't for you.
It isn't me that flies off the handle.
And relax. I think it's time now to take a look at those profiles.
Claude.
I'm sorry to take up your time, Doctor.
Oh, that's fine. Where's Antoine?
At home. It is not him I have come about. It's Hannah.
What's wrong?
She wants to cancel the appointment with the pediatrician.
What?
She's paying to see an autism specialist.
But if there is a problem, there are a number of things it could be.
I know, but she won't listen to me. I wondered if you could talk to her?
Claude, I honestly think that if I told her to do something, she would do the opposite. She's your wife, you tell her.
It is not how it works. Since we came here, things have been difficult. When she gets anxious, she gets angry, and then everything is my fault. The money, the vaccinations, everything.
And you let her get away with it?
And though it is hard for her.
Claude, do you value your marriage?
Of course.
Well, then I suggest that you stand up for yourself and for Antoine. I mean, he may be autistic, but he really doesn't seem it to me. You need to see a paediatrician.
That is why I need your help.
Claude, she is your wife. If she won't listen to you, then you need to make her. That is your job, not mine.
Hello, Doctor.
Miss Moore?
It's funny, isn't it? The minute I rang, I started to feel better.
Happens.
Still, I think you better come in. I think I need a full examination.
Nice house.
Thanks, Doc.
Sure he's not going to be back?
Not till late.
Maybe we should go to mine.
I don't think you understand, Doc. I need to get straight to bed. Come and check my pulse.
Well, your answers are most revealing. It's hardly surprising you have a hard time communicating. Michelle, you are a PZCT. And Vivian, you've come out very clearly as an OZTD.
What's a PZCT?
Well, in a nutshell, it's a personality type that's confident, capable, and self-assured. However, this is merely a mask disguising deep insecurities which, under stressful conditions, present as a stubborn, confrontational attitude, especially in relation to authority figures.
And I thought there was nothing in it.
So what's Vivian's then?
Well, it's really rather unusual to come across an OZTD. These individuals are constructive, respectful of authority, highly organised, and solution-orientated.
Ah, that sounds accurate.
But under stress, they revert to their judgmental, I told you so, and authoritarian fundamentals, treating those of real or perceived lower status with dismissive contempt. Now, what we can say about the pair of you is it's clear you have some extreme issues to deal with, not just in the dynamic between you, but as individuals.
That's a bit harsh.
Ah, well, you think that because you feel under stress and you perceive me as an authority figure. So to a certain extent, some rebellion is to be expected. What's important is that you learn to see these flaws and weaknesses for what they are. And in time, we'll be able to moderate your character towards something more fundamentally useful.
In time? You don't think we're going to do this again, do you?
Well, this is just the diagnostic stage. The whole programme could last weeks, possibly months.
I can't afford that kind of time.
Well, you can't afford to continue a dysfunctional working relationship like the one you have.
Ruth, have you ever got yourself tested?
Yes, I've undergone a great deal of self-analysis in training. And I have to say, I certainly had my own challenges.
Like what?
Well, before I started, I was ill at ease socially and had very little real ability to deal with individuals.
And you think that's changed?
Well, since doing this, I have been transformed to the person I now am.
Then that proves it's a complete waste of time.
There you go again, judging.
It is a judgment, and it's right.
Yeah, and your profile on me was total rubbish.
Anti-authority?
You don't have any authority. You're just a blind follower of some Californian psychobabble which holds about as much water as a cardboard colander.
Shall we do another exercise?
No! Think it's time to leave, Vivian?
I think so, Michelle.
You remembered you're buying the beers?
Yeah, I don't think I'm going to be much fun.
Why?
She's decided she doesn't want to see a paediatrician.
That's ridiculous.
So he asked me to talk to her about it.
And?
And I said, well, I'm not married to her, you are. Which went down really well.
So you've fallen out with 2 patients in one day. That's good going.
Thanks a lot.
Especially for someone with your tact and charm.
Just because you're in a wheelchair doesn't mean I can't punch you.
Perfect bedside manner. That's horrible. No, really, put it away. Please.
I gotta go.
What?
Something I haven't checked.
Like what? Great.
I don't think they were quite as prepared for this as you thought.
Oh dear.
No, they were very defensive. And I ended up bearing the brunt of the resultant aggression.
Oh, I'm sorry.
Well, I do think I can retrieve the situation. However, I think that getting them to the place where they need to be won't be a short process.
Right.
Well, if you call me to arrange the next session, I'll let myself out.
Yes, thank you, Ruth.
Oh, goodbye.
Goodbye.
What's the verdict? Have they signed a piece of court?
I'll let you know.
I bet whoever came up with that made a fortune.
I hope she doesn't. Some of the things she said were completely deranged.
I know, but it was so ridiculous, I didn't even care.
It's always the therapists that need the help.
So you don't think we do then?
We can work perfectly well together if we have to.
Yeah, like at the gala.
You're right. But then we did both have a reason.
Sam meant a lot to you, didn't he? Must have been really hard for you.
He was a lovely boy.
Yeah. Yeah, he was. Vivian, you know when she said I was a bit insecure and defensive? You don't think that's true?
No.
Good, because I think a description of you was totally spot on.
I don't think you're a bit. I think you're very insecure and defensive.
So it wasn't total rubbish then?
Not all of it.
You want to do some more?
Certainly not.
Good. I mean, we don't need her to tell us we see things differently.
Don't know about you. But I'm not going to moderate my personality for her or anybody else.
Couldn't agree more.
And if we're going to avoid such sources of help in future, I think we should try and appear to get on better than we do in any case.
Prioritise our work over personal differences.
Precisely.
Good. Well, that's agreed then.
What does she want?
She might know what the problem is.
There's just a possibility
No,
that...
don't bother. I've arranged an appointment with a specialist.
But in the meantime, if I could just...
Dr. Bell, don't you understand? I'm not interested in what you have to say.
But if I could just...
No! Dr. Bell, you've done nothing but patronise and insult me. Now, please get out of my house.
But I think we
Dr.
should...
Bell!
It's for Antoine.
I said leave.
Doctor, I'd like you to look at him.
Claude, I just...
I heard, but he's my son too, and if a doctor thinks they can help, you are not going to stop them. Dr. Bell?
Hello, Antoine. Do you think that you can do something for me? Can you stick your tongue out like this? Can you do that? Can you do that? No? But can you open your mouth for me like this? Can you do this? Ah, can you do that? Good boy. There we go. Let me have a look. Can you go like that?
It's ridiculous.
Thank you, Antoine. Well, you're right. He isn't just a late developer. Antoine has a tongue tie. It means that the piece of skin that attaches his tongue to the bottom of his mouth extends too far forward, so even though he wants to speak, he's not able to form the words properly. So, I think we found the answer.
Feel better?
Oh, yeah. Oh, much better.
Still can't believe we're doing this.
Oh, don't tell me you feel guilty.
No, it's not guilt. Just feel sorry for him.
Oh, don't.
Doesn't feel wrong. What is it?
Get dressed.
Oh, he's back!
Move! Come on!
How did he know?
He doesn't.
What did you tell him to come back?
What?
He said he was working it. What's he doing here now?
Well, I don't know. Why don't you ask him? Oh, yeah.
Come on.
are you, darling?
Hello, darling.
Nice.
Thanks.
I'll write a letter to the consultant today and they'll contact you about the operation.
Thank you, Doctor.
I'm just glad we got to the bottom of it.
We're still sending him to a specialist.
Why?
Well, if we're paying them, then they have to listen to us.
Mrs. Moreau, I listened and I think I found the problem.
I won't get so smug about it. Because if you'd taken it seriously in the first place, we wouldn't have had the last 3 months of anxiety, would we?
Do you know what, Mrs. Moreau?
Thank you. It's a miracle.
I need a beer.
Does that mean it went badly with Mrs. Moreau?
No, Antoine had tongue tie, so we can get that sorted.
It might have been worth checking for that soon.
Yeah, funnily enough, she did point that out.
Yeah, I bet that went down well.
Actually, I told her that she was right.
I'm impressed.
And I said that even though you're not the easiest person to get along with, you do have a lot more experience than me. And she agreed. From now on, she's going to ask for you.
So how can I help you? I'm not having any of that, okay? So put it away right now.
For the first time, I'm the other man. I'm not finding it fun.
I thought you loved my body.
I do love your body, but I do not want to have to look at it constantly.
Relax. If I catch you, you're dead!
Doctors is on the move on Monday. As from next week, you'll be able to catch it every weekday at 1:40, straight after the news.